So hello, welcome to everyone. Welcome to the representatives of patient organizations around the world who have participated in making Rare Disease Day as successful as it is today. I welcome the representatives from Europe, Africa, North and South America, Asia, Australia, and as we're all here ready and preparing for the 8th edition of Rare Disease Day, today's webinar brings us together to remind us about why it all started, why and what is the spirit of Rare Disease Day, and to understand more about this patient-driven awareness campaign. So I'm Lara Chappell. I'm Communications Director at EURORDIS and in charge of managing the international campaign for Rare Disease Day. And here at EURORDIS, we produce the communications tools that we provide internationally. And I will be moderating today's webinar. We'll be together for about 60, 90 minutes. If you have any problems with sound, or misunderstanding, please don't hesitate to text questions. And we have 3 presenters today. First, we're going to hear about the history of Rare Disease Day and what we mean when we say the spirit of Rare Disease Day. Then we're going to hear from a single country, and their experience as an umbrella patient organization who's been here since the beginning, building awareness locally, sharing best practices. And then finally, from a consultant to teach us about communicating, using common tools, and being part of this international momentum for rare diseases. Between each of the presentations, we will field questions, again, that you can type on the chat. Please don't hesitate to do so. It's to be interactive. Let me introduce them today. So first, Anja Helm, who is Senior Manager at EURORDIS of Relations with Patient Organizations. She's been working at EURORDIS since the idea came to have a Rare Disease Day back 8 years ago. She was part of the team who conceived the initial plan, and she's seen all the changes from the beginning. As we have watched the results of Rare Disease Day surpass our most wildest dreams. So as we witness its growth every year, Anja, please remind us of that initial plan and what we mean by the spirit of Rare Disease Day. So let me get her on. Thank you, Anja.
Thank you, Lara. Thank you for joining us today. Rare Disease Day is an idea that was around many years before it actually really happened. Lots of patient representatives in Europe talked about it, about having an awareness-raising event that everybody would do together. And then one day at the meeting of the Council of National Alliances in Berlin many years ago, the Swedes came up with the idea to hold the event on a leap year on the 29th of February. And everybody liked that idea, and it was decided to start Rare Disease Day 1 year later. And the first Rare Disease Day then happened in 2008. So thank you to the Rare Diseases Sweden organization who had that idea, who that kind of kicked the whole thing off. Why did we want to do it? The idea was to have a real awareness-raising campaign across Europe and later on across the world, but that we didn't even dream of then in 2007. And it was really mostly destined to raise awareness among the general public and the media, because as we all know, rare diseases are still very much unknown in many countries. Nobody knows anything about it, or at that point didn't. Nowadays it's much better as well, thanks to the Rare Disease Day. And it was a great idea, I think, and a great concept to get people starting to talk about it and to write articles about it and to make the general public aware of rare diseases. So the first Rare Disease Day took place then in 2008. We started very small with our national alliances who worked together in the Council of National Alliances. It was really a completely patient-driven campaign the first year, and still is, organized by those alliances. And I think the very first year we had 18 countries who participated. But in each of those countries, with the alliances who organized the events, there were, of course, participants from all the stakeholders, politicians, health authorities, policymakers, industry, researchers, health professionals, doctors, nurses, and so on. And the spirit right from the beginning was really that it was something that people did together for one common cause, and that worked very well. Right from the beginning, we did have very little material, but that worked fine. We had a first small website that was really made in-house. We had a logo that was produced very much in the beginning. And we, as EURORDIS, made a poster from the first year, and we have done that every year, that everybody in the national alliances and later on all organizations can use to share the idea, the theme, and the slogan of the year. So you can see on this slide how things started with 18 countries where patient organizations organized events in 2008, 30 countries with things happening in 2009, 46 in 2010, 55 in 2011, 63 in 2012, 72 in 2013, and 84 in 2014. It's amazing. We're very proud of this achievement, and it's amazing to see how, without us doing that much in the end, because we're a small team and with the alliances and the organizations in all the countries, how it gets picked up in countries that we had never even dreamed of that they would one day participate in faraway places, that all of a sudden we get some article or some information that they did a video or they did a conference. And it is growing and it's spreading, basically not on its own, but very much without us having to go to people and telling them how to do it. So that's amazing too. So as I said, we started with just a logo, the info pack that we gave to national alliances with information about how to do it, what can be done and so on, and the poster. Then we added social media with Facebook, Flickr, Twitter, and YouTube in 2009. We then wanted to open up the whole thing a little bit more. National alliances are great, but they are not everywhere. They don't exist in every country. We want other countries to participate and as well other patient organizations. And so in 2010, we launched the Friends of Rare Disease Day, where people from all over the world, organizations from all over the world can sign up as friends of and say what they want to do for that day, what their special intent is. And that works very well as well. And we had a new visual identity for the website in 2011 that you have been seeing since then. Another thing that we added in 2012 and that worked really well is the video, the Rare Disease Day video. I'm sure that you have all seen it. I think that all the videos are still available on the website.
Yes, they are, absolutely.
Yeah. So we had a really lovely video done in Ireland in 2012. And we have since then had other videos in 2013 and 2014, and are currently working on one that will come out for Rare Disease Day 2015. Another new feature that we had in 2014 is that we have an ambassador now for Rare Disease Day. That's Mr. Sean Hepburn-Ferris, son of late Audrey Hepburn, and we're very thankful to him to help us along with his knowledge and his connections. The important thing, I think, for everybody to understand is that Rare Disease Day is something that is supposed to be a shared event that everybody who is, well, every patient organization definitely, and other organizations as well for non-commercial purposes can participate in. They can use the information material, they can put the logo up if they organize events for the Rare Disease Day. They're not supposed to use the logo for other things, of course, but anybody who organizes something in the spirit of Rare Disease Day, in the spirit of raising awareness for rare diseases across the world for rare disease patients, can participate, can use the logo, can use the poster, can use all the material that we put up on the website, and that's free of charge, of course. And that should be shared as much as possible, so to give the whole event some kind of unity and a common visual identity. And that has been working really well as well. So I think the success of Rare Disease Day is very much as well linked to that, that it's a thing that everybody can use easily and can spread very easily, and then adapt, of course, to local or national identities or realities that, of course, are very different from one country to another.
Okay. Do we have any questions for Anja? For now, we don't have any questions, but I'd like to open it up. We don't have any questions coming on. We have several people online. Maybe questions will come a little bit later. But thank you, Anja, for helping us understand that we have made, and as every year we leave these communications tools, the logo, the poster, and the video can be downloaded for free on our website. And when they're used for non-commercial purposes, can perhaps help your local needs for the as communication tools for your own communication. So please use them. Okay, I'll move on to our next speaker. We are very lucky to have today Avril Daly. Yes, sorry, I just had an echo. But she's with us from Ireland. She is chair of the Irish National Alliance, which is called Genetics and Rare Disorders Organization. We also know her very well here at EURORDIS, as she is vice president of EURORDIS, and she is also chief executive of Fighting Blindness. Today she is here to share her experience organizing events and building awareness in her country, Ireland. Rare Disease Day has been a great success there, and despite her extremely busy schedule, we thank her for sharing her ideas and her experience with all of us. So, Avril?
Thank you, Lara. I'm delighted to be here today to talk to you a little bit about our experience in Ireland with regard to International Rare Disease Day. I represent a voluntary umbrella group made up of parents and patients affected themselves or representing the interests of people with rare diseases. Most of us are involved with other organizations, so we, like most of you, have extremely limited resources, extremely limited time, but we attended a CNA meeting of EURORDIS in 2007 in Paris, and for us that was really the start not only of developing our communications around Rare Disease Day itself, but also because at the time we were doing a lot of work in relation to promoting national plans for rare diseases. And our experience has been that this timing was absolutely excellent in giving us the tools, the information, the confidence, I suppose, as well, to start that advocacy process in very real terms. Just to say that we also worked very closely with two patient umbrella groups that have an interest in rare diseases, the Irish Platform for Patients Organisation Science and Industry, IPOSI, which is very concerned with the whole issue of orphan therapies, access to emerging therapies, and also the Medical Research Charities Group, which is involved in research and has a particular interest in rare disease research and the promotion thereof. So we were able to thankfully rely on some of the resource of those secretariats in approaching this, so I think it's important to say that up front. So today I've been asked to talk about our experience, and as I said, it really all got started for us in 2007. We had very little time, of course, to organise events, but we knew that this was a fantastic opportunity because obviously the Friday the 29th of February 2008 was going to be our very first time to really put our faces and our purposes out there. So what we decided to do was to hold an event in the Mansion House, which is the Lord Mayor of Dublin's residence. We called on some key stakeholders in the area of medicine, in the area of science, and patient representatives to talk about the work that we've done maybe over the years, because here in Ireland we've been advocating the issues related to rare disease for many years, and certainly since about 1988. So we wanted to give some background. Now, we haven't come out of nowhere. We've been around for a while, and this is what we're doing now. So that was our focus. And of course, it was incredibly important to have the resource and the support of EURORDIS and our colleagues in EURORDIS. We were able to, talk to other member states, ask other umbrella groups and national alliances what they were doing. And I think it's important to note that there will be things that are more particular for your country at any given time. So while you might have an overarching theme for Rare Disease Day, it's important to see what is relevant to you in your country at that particular time that can benefit you in advocating for the development of your plan or other policy issues with regard to rare diseases. That's very important. And we were very fortunate to have the support of EURORDIS in all of that. So we decided to have the event, and that worked out very well. Prior to the event, we had a slot on our national broadcaster. We had on television. We got a slot with a patient and a patient representative. On our morning program on TV, we had radio, and we had some print advertising as well. We launched our balloons at the Mansion House, with beautiful picture opportunities with many patients affected by a broad range of rare diseases, and we got some good uptake. But it was very much our first step in that direction. So that was 2008. We were very, very happy. We felt, okay, we've raised a little bit of awareness, and now where do we go from here? So it was important, I suppose, for us to, Rare Disease Day happens once a year, but rare diseases and the issues surrounding rare diseases are important to us the whole year round. So it kind of allowed us to sort of always think that Rare Disease Day is the time we get together to really push our agenda. But let's take the relationships that we formed in developing the first Rare Disease Day, talk and discuss throughout the year how we can generate media, develop our relationships with media outlets, using very specific individual cases, case studies, or legislative issues. And we did that throughout that year. And then we had our next Rare Disease Day in 2009. And that was very much centered on a policy discussion with regard to issues to do with accessing orphan therapy. And that was a very successful event. We had it in EU House here in Dublin. For the first time, we had some key policymakers involved in the development of legislation around this area that we really wanted to engage, because at that time for us, there was no single person in our Department of Health who was responsible for rare diseases. So getting someone in who, by all intents and purposes, by being there, was that person, was a huge step in the right direction for us. So 2009 saw us kind of change slightly and kind of, again, grow in confidence. The event attracted more stakeholders, more patients who through media heard more about us. And while we did that work, we were still linking in with our colleagues in EURORDIS. We were involved in the development of the next step, which was the 2009 event, the themes surrounding those events. We utilised the posters, the Facebook pages, and it started to grow. Then again, 2010, we had an event on Rare Disease Day where we used the POCA project, which was a discussion forum devised by EURORDIS, which allowed us to take very specific issues contained in the recommendations for the national plan, which those recommendations had been published in 2009, and this was kind of our first Rare Disease Day after that, where we could really focus in on those issues. And we divided into groups, we discussed specific issues and reported on them, and again, more people came, more people got involved in the discussion, so things started to grow and grow. Then came 2010, and we started to organise our Europlan conference as well with our various stakeholders. And so again, bringing in more people who were willing to speak on Rare Disease Day 2010 for us. With regard to specific issues, again, we had another event, an awareness raising event. We had a photo shoot. We had more patients and on TV to discuss their particular experiences of living with a rare disease, what a national plan would mean to them. So yeah, it continued to grow. And I suppose then in 2011, just early in 2011, we actually had our Europlan meeting in Dublin. And that happened very early in January, and it brought together 160 stakeholders to discuss Europlan. So of course, Rare Disease Day was happening very soon after that for us, so it wasn't feasible for us to have a big event that year, but we did have some photo shoots, again, more media. And what we did is we built up a sort of a portfolio of case studies of patients that had very different needs, very different experience that we could draw on in and around the day itself. And again, more media. We started to engage more with our minister, our health ministry. Our then minister had attended had been made aware of the Europlan event and decided to put together a steering group to develop a national plan for rare diseases. That was a really great thing to happen in around Rare Disease Day in 2011. So we really felt, okay, well, we're on our way now to developing more policy with relation to rare diseases. So that took up a lot of 2011 for us. And then, as Lara mentioned and Anja, in 2012, things started to really ramp up and we started to get very sophisticated in how we delivered our message. Again, the Facebook pages were growing within each national alliance. People were giving us more and more stories. The more events we had, more people started to attend, and therefore we had a broader group of people that were advocates for us. And by virtue of the fact that we were developing a national plan for rare diseases, we were sitting now with our Department of Health. And so therefore they got more involved in the development of Rare Disease Day and activities around Rare Disease Day. So that was very good. So we were able to demonstrate how the various stakeholders were working together, and that was really the whole linchpin, raise awareness of this growing movement. And as we were developing our national plan, of course, we started to learn more about statistics. How many people are being affected really in this country? What issues do we really have? And what can we put in place? So we had more information, more solid information, and that attracted more media attention, that attracted more political attention. We started to meet regularly with what we call in Ireland our TDs, which would be our representatives in Parliament, and also our senators, which is our second legislative house in this country. So, we had debate and we had our issues raised within our Parliament. So this was a really, step by step, we were getting there. We were moving along very, very nicely. We had our video, which was actually broadcast on TV here in Ireland, and it was filmed in Ireland using Irish patients. We took the stills from that video and we used them, the various individuals, as postcards, and they were sent around to media outlets as a sort of a teaser campaign prior to Rare Disease Day. So that again, really showed sort of a much more sophisticated, much more coordinated approach to Rare Disease Day. This would have culminated, of course, in our campaign around our national plan to have it published by 2013. One of the key issues in 2013 and one of the themes was cross-border care. And we worked very closely with our counterparts in Northern Ireland to look at an event here in Dublin. And we were fortunate to have had City Hall, which is a fantastic building in Dublin City, a historical building, to utilise that for a wonderful conference on cross-border care with the key stakeholders involved from both north and south of the border. We had our minister in attendance, and we also had the Northern Ireland minister in attendance. So it was a really great way of showing coordination across a border on a very small island and develop our relationships with our counterparts in Northern Ireland. So it was an extremely successful Rare Disease Day, And like every rare disease day that's passed, you want to, what are we going to do next? What do we do next? And again, with our colleagues and our counterparts in the Council of National Alliances at EURORDIS, the theme for 2014 was decided, and it was going to be care. That's a very broad issue. It can be interpreted in many, many ways. So our theme was Show You Care on Rare Disease Day. And so in 2014, we continued with our media, our case studies, with our advocacy for having the national plan, which was as yet unpublished, but we knew ready to go, and we were kind of used that opportunity to put pressure on our political representatives to ensure that this plan was published as soon as possible. But we also went to Northern Ireland this time. So the Irish stakeholders in the Republic of Ireland travelled this time to Belfast, and we had a wonderful conference in Belfast looking at the themes of care. And it was a brilliant opportunity for all of us to meet each other and to discuss what was common to us, where we all were in relation to legislation, and forge, I think, really great friendships and partnerships. And that was Rare Disease Day this year. Fortunately, our national plan was published on the 3rd of July by our former minister, and it's supported by our new minister. And I and my colleagues in Gerdo and in the Irish Platform for Patients Organisation, Science and Industry, IPOSI, and the MRCG, we really strongly believe that without Rare Disease Day, the confidence it gave us, the supports it gave us, and the materials, the ideas, we wouldn't be in a position where we would have had our plan published at this point. Now, of course, we have a huge road to travel with regard to implementing that plan. A lot of work is being done on that currently. But, I suppose what I wanted to convey to you today is the fact that it really has impact. You can do very small things. You can grow from little acorns, very large oak trees. And we feel we're nearly there. We're getting there, and you can too. But it is important to talk, to share your ideas. We can all learn from each other, regardless of how progressed one organisation or one country is. There's so much for us all to learn, and there's so many experiences yet to be shared. And I do believe that Rare Disease Day has the potential to be a world-leading awareness day, as with, for example, AIDS awareness, cancer awareness, autism, and many other conditions. We have the people, we have the will, and we have the fantastic resource in EURORDIS. So that's my experience. I don't know if anyone can hear me. So there's some photographs there. That was this year, actually, in the Mansion House in Dublin. And there's a photograph on your screen of our clinical lead, Professor Eileen Tracy, who has been appointed by the HSC to oversee the development of a clinical programme for rare diseases. That just happened this year. And some people you might recognise. On the left, as you see, is Dr. John Devlin, who is the chairman of our steering committee on the Department of Health, and has been a great supporter of ours and really helped us in supporting the development of the national plan. He is standing next to Anne Lawler, who is our information officer here at Gerdo, and Anne is a mother of a young woman who has 22q11, a rare chromosomal disorder. Behind her there slightly you can see is Philip Watt, who is the chair of the Medical and Research Charities Group, and he is also the CEO of Cystic Fibrosis Ireland. And to the left of Eileen, who's the lady holding the booklet there, is Evelyn Mulroe, who some of you will know is the CEO of IPOSI. That was this year's Rare Disease Day. And that's all of us in the Mansion House. On the 26th of February, and a number of stakeholders in that group, and we're raising our hands for Rare Disease Day. We have a number of ministerial representatives, clinicians, scientists, policymakers, regulators, researchers, and of course patients, and they're all there in that photograph.
Okay, thank you very much, Avril, for explaining to us how you have used Rare Disease Day so well as a springboard for your agenda in Ireland to involve media, to involve politicians, and to get things done all the way to a national plan in Ireland this past summer. It's very exciting to hear all the things happening there. I'd like to open it up for questions for Avril, if there are any coming in. We have over 20 participants from around the world. We thank you for attending. Chat is not coming through. I think there's a question. So maybe we'll move on to our next speaker. Thank you again, Avril. Yes, so the next speaker is in Brussels. It's Thomas Kanga Tona. He's joining us he's client executive from the healthcare department at Burson-Marsteller, Brussels. Burson-Marsteller actually offers EURORDIS in-kind support for the international campaign for Rare Disease Day. They have been helping us for the last 2 years now. This will be the third, helping us to build those strong communications tools for your use and for the campaign, and also supporting us for our policy event that we hold every year in Brussels. So Thomas is here as a consultant to talk to us about using communications materials and being part of an international movement. Thank you, Thomas.
Thank you very much, Lara, for the introduction and inviting me to speak during the webinar. So, as Lara said, I will talk you through actually how to make sure that the communication materials are streamlined actually and are used consistently throughout the world by participating organizations in order to better raise awareness on the Rare Disease Day campaign and its goals. So in the next slide of the presentation, you'll have this. I will just talk to actually show you the different advantages of having a consistent logo. So the first thing I want to tell you is that first a consistent logo and the unified logos can help your initiative's identity. So it helps people around the world who are confronted with your communications materials actually better identifying that this is the Rare Disease Day and that you are and your organization is part of this global movement. The other thing that I want to bring to your attention is that using the same logo improves your initiative's coherence. It means that actually you are part of the same goal, and you share the same values as all the organizations who are participating in this initiative, including of course EURORDIS. The third thing that I want to talk you through is that this consistent logo can also help the visibility actually of the Rare Disease Day, because of course the more the Rare Disease Day logo is used within your communication materials, actually the more this initiative is actually visible. Which brings me to the next point, which is that the Rare Disease Day initiative, when it is communicated along with the same logo, makes it memorable. In the previous slide, you will see that actually on the right of the slide you have actually all these outlets, actually these social outlets, which is the Rare Disease Day website, where the Rare Disease Day Twitter channel, the Rare Disease Day Facebook account, which Anja touched upon a few minutes ago, actually, which includes all the same logo. And at the bottom and the left, you see that the logo here was used by participating organization, but was slightly changed, which actually does not help the people who are confronted and who are seeing the communication materials of this participating organization relate the initiative actually to the Rare Disease Day. We can see actually that it was the Rare Disease Day logo. We can see that we have the top of the hands which are used for the Rare Disease Day logo, but actually the colors have changed and you have flames coming out. A certain degree of creativity is of course welcome, but when it comes to trying to ensure a proper and coherent communication around the Rare Disease Day, this is the kind of things that we would at least advise you actually to ask EURORDIS about before doing it. Which brings me to the next slide. So, of course, I've talked you through actually what are the assets of having a consistent logo, but actually there are also simple things to make sure that you have that you are using a consistent logo and that your initiative is really actually in the frame of the Rare Disease Day, which will actually, in the end, and eventually help you actually better advocate for your issue. So I will tell you about some safeguards, some simple safeguards that exist in order for you to ensure the Rare Disease Day logo. So the first thing is that as Lara and Anja told us a few minutes ago, EURORDIS has put on the Rare Disease Day website a lot of materials that are ready to be downloaded. They are free and they are easily accessible. EURORDIS has put together a download section on this, which is easily accessible, and which we would also advise you to put and to highlight on your own website. Should people, whether they are members of your association, whether they are people who want to advocate for Rare Disease Day, should they want to use it. In terms of other things that you could, for instance, improve, it doesn't really show up really well on the slides. But actually, EURORDIS has also put a simple disclaimer on the use of the Rare Disease Day logo, which would also advise you to make really accessible and more easily accessible on your own website. And should you still have questions, of course, feel free to ask EURORDIS, because they have an oversight on what's going on at national level and what national organizations or participating organizations are doing. So they can have an overview and better advise you on how to use the logo. So this part was more about how participating organizations can make sure that they are using the logo, the Rare Disease Day logo, in the right way, and they have a consistent use of this logo. But there are also some other cases during which third parties use the Rare Disease Day logo for purposes which are not in line with the spirit of the Rare Disease Day. So I first would like to talk you through how this misuse of the Rare Disease Day logo by third parties can actually undermine the spirit of the Rare Disease Day. So first thing, when the Rare Disease Day logo is used by parties that want to use it for commercial purposes or for reasons which are not in coherence or not in line with the Rare Disease Day's spirit, it of course harms the initiative identity. The second thing is that it harms the initiative's credibility. So these points cover and go back and cover the points which were used, which I talked you through in the first slide. And of course, the third thing is that the misuse of the Rare Disease Day logo harms your organization's reputation, and in the end can impede and can harm actually also your values, the values that you are upholding. So it's really important for participating organizations actually to make sure that the Rare Disease Day logo is not used by third parties for the wrong reason. as Lara has explained, the Rare Disease Day logo is of course an open initiative, which is actually it is a grassroots initiative, which is really members driven. So it would be really a harm if other parties which are not actually in line with the Rare Disease Day spirit use the logo for bad reasons. So the things you could do in order to prevent the misuse of the Rare Disease Day logo are on the next slide. So should your organization actually agree and have a framework to actually to work with external parties, external partners. For instance, we know that national associations are agreeing and are doing are sometimes have agreements with pharmaceutical companies or other commercial partners actually for the use of the Rare Disease Day logo, or our partners for other initiatives. So the first thing to do is first to have a written agreement, which can be then referred back whenever whenever a misuse or the use of the Rare Disease Day logo occurs. So this letter agreement could be used, for instance, to agree on the cases and the context of use of first the National Association's logo, and then of course the Rare Disease Day logo. So whenever a misuse occurs, you can easily refer back to the content of the letter agreement. It is a useful tool that sometimes associations can forget, but which is really helpful when misuse occurs. The second thing, which is also really useful if you can't produce or draft a letter agreement with your commercial partners, is also improving the accessibility of the disclaimer on good use of the Rare Disease Day logo. So you can easily copy paste or translate the disclaimer which is on the Rare Disease Day website, in order to make sure that partners, whenever they use the logo, know that it has to be in line with the spirit of the Rare Disease Day logo. And the third thing that you can do is of course also referring to EURORDIS when the misuse of the Rare Disease Day logo occurs, in order to agree on any preferable next steps actually in order to prevent it from happening. So this was my contribution actually to my modest contribution to the spirit of the Rare Disease Day initiative. So now I'm open to any questions you could have on the things I've talked you through. So so yes, so I'm available to answer any questions. Thank you.
Okay, so thank you very much, Thomas, for explaining good use of the communications tools. And again, these communications tools and the logo are able to have a common international part of the national movement, and to be part of that movement. And we make that available to whoever would like to, but again, it's not to be used for commercial purposes. And we are unfortunately, as we've seen over the last couple of years, victims of our success, and we've seen misuse of the logo, and we would like for people to let us know when and if that is misused. But that's also part of the success. So we are getting some questions. Several people have asked if the presentation would be made available, and yes, it will be made available. This webinar will also be made available on the website. I remind everyone that, as we have done the last 2 years, the Rare Disease Day website will be open and available as of 100 days before Rare Disease Day. That falls this year on November 20th, and I encourage everyone to put up their events and information about what they are planning and preparing locally, so that all patients and families and anyone who wants to participate in Rare Disease Day can attend. We have a question from Ingrid from Belgium. She's asking, how do you deal with questions from Media Planet? They always present it as something special and free, but they want money from us or from our members. Okay, so that's a good question. Maybe Avril, I don't know if you would feel comfortable answering. I don't know if you had the situation in Ireland where there's kind of a trade-off between, I don't know if you know the Media Planet question, but it's a media who is writing a lot of editorial about what is happening for Rare Disease Day, but at the same time, they're selling ad space. And so the question is judging whether paying for ad space, giving editorial. I think it's a judgment per country, but I wanted to know if you had, come into that problem or.
I think you're referring to supplements that come with newspapers.
Yes.
Is that what you're discussing? Yes. We approached and we were asked to put an ad in, and we couldn't do it because we didn't have the money for that. It's like anything. You have to realize that there are media opportunities out there that are advertorial, and that people and that certain media outlets will recognize that there is a lot of interest in a specific health area, like anything else, and that there is an opportunity for commercial gain. You have to weigh it up yourself and say, well, is this an opportunity where we will have greater exposure and therefore a better outcome where our message is delivered more widely, or we become ingrained maybe in very specific people's minds. So it's really, I would always, when approached by somebody who wants you to advertise essentially or pay for an advertorial, just look at the circulation of the actual piece. Who does it go to? What's the readership? That's what that means, Is that a readership that I want my message to go to, that I'm prepared to pay for my message to go to? In certain cases, it might very well be, and in other cases, no. And I think in the context of rare diseases and national alliances who are not cash rich, who are limited by budget, it's often impossible anyway. So that's just been our experience. It's always, it's not easy, but to try to get the editorial piece or the opinion piece in a relevant publication through cooperation with the editors and news journalists that are working in that outlet is our best way forward. That does take time to build up those types of relationships. You can see both sides.
Yes, thank you very much, Avril. I think that's exactly it. If Ingrid, we can put you in touch with someone who has already negotiated with them. EURORDIS has been in contact with Media Planet as well on our side because they were misusing the Rare Disease Day logo, putting it in their signature when asking for the advertising space, which we didn't. So they were using it for those commercial purposes, and we have told them more than once to stop that. So thank you for bringing up the subject. Thank you, Avril, for giving the different points of what you need to be looking at when you're deciding where and which media to use your budget, if you have some. Those are exactly the questions to ask ourselves. Okay. Yes, so I think that's about it then for the questions. Please feel free to send me an email if you have more questions. I will as I said, make the presentation available to everyone. I'll email it out. If you have any ideas or any other subjects on Rare Disease Day that you would like us to hold a webinar between now and February, things that you would like help with, ideas, please don't hesitate to send those ideas to me as well. We have been working very hard with the Council of National Alliances and the Steering Committee. We have decided the Rare Disease Day 2015 slogan. We have decided the slogan to be living with a rare disease, as we want this last year of the solidarity overarching theme to lead the discussion to be around the patients and the families. And I ask all of the Council of National Alliances representatives to look in their mailboxes for the voting bulletin for the slogan. We have 3 slogans to propose that will go to vote over this next week, and we will announce in October via our e-news newsletter the slogan and the official slogan that is to be chosen for Rare Disease Day 2015. So we are working on all those communications tools that Anja talked about earlier, and that Avril explained how she was able to use. And I thank Toma for reminding everyone to be careful about modifying the logo and the materials and using a common message. So thank you, Belinda Khan, who likes our Living with Rare Diseases slogan. I hope everyone likes it. And as Avril said, each of us can use it in our local countries for your local agendas to get media involved, to get the public involved, and politicians involved. So thank you very much, and we look forward to exchanging with you over these next few months as we prepare for a bigger and better Rare Disease Day 2015. Thank you. Thank you, Avril. Thank you, Toma. And thank you, Anja.